Emily, thank you so much for joining me today. I'm really excited to hear more about what it is that your company is doing, hear more about your experience with the workshop that you've been through. So first, maybe let's hear a little bit more about the industry you're in. I hear it's very regulated, maybe more than others. Tell me everything about the solution you're working with.
Yeah, that's a great question. So I'm working as a technical PM for Bariatric Centers of America. We're an OEM partner with Salesforce. And to your point about the space being more regulated, everything that we do has to be both HIPAA and SOC 2 compliant. From a security standard all the way to dealing with sensitive patient information, we have to be very mindful of those pieces. Not only when we're building things out within the managed package itself, but any third-party platforms or APIs we're considering, even within some of the build out over the lab for the last couple of days, it's had to be, front and center.
And so I want to believe that when you think about, having like a HIPAA compliant platform, there are some choices to be made between, do I want to build it myself or do I want to take advantage of maybe a more turnkey solution? This thought process went through, your company's decision to build it yourself or use an existing platform?
In terms of a BCA overall or specific to the agentic?
On the BCA overall,
BCA.
yeah.
I think fitting things into Salesforce in terms of patient tracking, in terms of those requirements around HIPAA compliance, it made Salesforce a great option as a CRM for patient tracking because that layer, that compliance was already there. So that takes a lot of the additional work off of us building a product if we are not having to put that entire process of ensuring things are already aligned with that on our shoulders, if that makes sense.
Yeah, so you could focus directly on building your product, building what's going to make your customers happy rather than reinventing the wheel. Makes sense.
100%.
Now, when I'm thinking about the world in which you live, which is very regulated, where you have to go by the rule, we now entered, for a few years now, the Agentic Era, where we discover a system that is less deterministic than what we were used to. How did you started looking at it, of this agentic wave, coming from a place that has always been very deterministic?
That's a great question. I think we're looking at any conversation that we have with a potential client, which would be or from a private practice to a hospital system. We're looking for ways to increase the number of potential patients to actual patients, whether they're a surgical patient, they're on a medical weight loss or nutrition therapy pathway. We're looking to assist them in increasing those conversions. But we're also having a lot of conversations with them about how we can make their lives easier. We can automate some of these processes. There's a lot of manual work, typically in terms of reaching out to that potential patient, gathering additional information about them. So I think that's something that really resonates with a bariatric coordinator or an office manager, for example, to say, are you going to keep track of all of my potential patients or prospects throughout this process? Are you going to automatically remind them of upcoming pre-operative requirements, for example? Things like that have been really valuable. So that was really central to a lot of our decisions.
So when you're thinking about your use cases, the ones that for which you could be using agentic technologies, are you trying to focus on where the biggest manual work is located? Is there where the biggest value is for an agent to come and help?
That's a really good question. Yeah, I think so, because I'm thinking about some processes that one of the things that I talked with our CEO about earlier this week is he said one of the things that keeps him up at night is if somebody submits an interest form or reaches out to his office on a Friday night, how long is it going to take to get back to that person? So I think it's the manual piece, but it's also caring about that patient journey and how can we make that smoother and ultimately support building a relationship with that patient through automating some of these processes.
Understood. So having the 24/7 availability and be able to engage.
Exactly. Yeah, you're more responsive.
Yeah, that makes sense. So Now that you've been experimenting with our hybrid reasoning engine for the past 48 hours, how did it change the way that you perceive the creativity of, agentic AI and how it can fuse with the use cases that you're supporting?
Absolutely. I think that this is extremely beneficial to some of the use cases or goals that we had coming into the lab. So we need to, particularly with that HIPAA aspect of things. So if you think about sensitive patient information, PII, for example, within the hybrid reasoning, we're building processes or agents that are able to reach out to that patient or prospect in some cases and ask for additional information from them. And within that hybrid reasoning, it needs to be able to say, all right, I need these pieces of information if you haven't provided them yet. If you have, that agent needs to essentially hide that information in outgoing communication and pull only information coming back in. And in that sense, we're able to continue to maintain that patient confidentiality using the hybrid reasoning. So yeah, I'm very happy with what we've been able to build.
Oh my God, I'm gonna 100% steal this use case, at least as a talking point, because it's really crisp, the way that, yes, to be HIPAA compliant, there is this path that needs to be followed by the agent and not another.
Yeah, absolutely.
Yeah, thank you so much for sharing that. Now, when you think about how, you are prioritizing what agentic use case to bake into your solution, did the world of agentic AI change the way that you are choosing what to work on next?
Absolutely. I think from a product roadmap standpoint for BCA, we're looking at capability and resources around what we can build. Agentforce has significantly broadened what we're able to add to our roadmap for 2026. I think some of these pieces of offering to potential clients, some of these pieces that will reduce the burden on those people who are essentially the front end users. Those are the people with the kind of boots on the ground perspective. They're building those patient relationships that I mentioned earlier, being able to make their lives easier, being able to do that much more easily from a build standpoint has allowed us to iterate a lot more quickly.
We should have a name to measure that, level of friction that gets removed by an agent being added to. Maybe there is a name for that.
A name? Well, that's a good question. I can't think of a specific
friction
name.
KPI.
A friction KPI. Yeah, a friction KPI. Frustration KPI.
Yes.
But if you think about one individual coordinator who is working with hundreds of patients or potential patients, for example, and they have to individually reach out to each of those people, get information from them, work with insurance providers as well, enter that information to a system, being able to take some of that, give some of that time back to them, I should say, is invaluable because then they're able to invest in additional relationships.
Time back. That might be one that we rebrand.
Time back. Yeah,
yes.
I like that.
Thank you so much. I so appreciate you sharing your insights, and I'm looking forward to seeing how all your learnings from the past 48 hours are going to make it through your solution.
Thank you. Yeah, we're really excited. It's been an invaluable experience, and I think not only from getting to learn more about some of the capabilities of Agentforce, but having access to some of the most skilled individuals within this space, getting to brainstorm with them and come up with solutions. We've been able to move forward more quickly than I anticipated, and that's really exciting.
Would you have a word for advice for someone who want to learn about building on top of Agentforce or building their first agents, where they should get started? What was helpful to you?
I'd say it will be easier than you think it will be to get started, and you can build out more than you thought you could within the lab.
There you go. 48 hours is all it takes. Thank you so much.
Thanks for having me.